Now, 500,000 people in Johannesburg are living with HIV, and countrywide, almost 1 in 5 adults aged between 15 and 49 are HIV positive. Now, that's a 5 percentage point increase from 2000. A new study by Washington University's Institute for Health Matrix and Evaluation says 5.3 million South Africans under the age of 50 are HIV positive. For reaction on this, I'm joined by Steve Letsike, who is the South African National AIDS Council's Deputy Chairperson. Good evening, Mr. Letsike. Thank you very much for your time. Just your reaction as the AIDS Council to these new numbers.
Thank you so much for the invitation. It's actually Ms. Letsike. Our reaction to the study that was released, I mean, it's expected. Details that are out there because the program under the National Strategic Plan has actually spoken about, which is goal 2, increasing number of people living with HIV to be on treatment itself. So more evidence, of course, will suggest indeed how many more people we need to put on treatment. So it's finding the people who are positive, which is part of our 90-90-90 strategy. So the missing cases and those who need to be on treatment are expected, of course, to increase in that manner.
How successful have you been over the years in, bringing medicines and taking care of HIV-positive people?
You see, the most important thing is to recognize through the NSP itself, we have been very successful to ensure that we reduce the number of new infections, although, of course, we are really reducing at a slow pace, but there is reduction of new infection rate that we're seeing. So more people are preventing, and we need more people to prevent the new infection on its own. But also is that the biggest treatment program in the world celebrated today, it's really South African treatment program with over 4 million people that are on treatment itself, and we are expecting in the next 2 years to put 2 more million people on treatment. So that's the biggest treatment program that we have. What we need to ascertain, because of challenges faced by our health system at local level, in facilities, in hospitals, we want to ensure that the treatment program does not become disrupted by drug stockout and many other challenges that we are seeing over time. But also one of the biggest challenges that we've seen is the high number of defaulters that we are experiencing. People are having treatment fatigue. So those are some of the challenges we are experiencing. However, we still are certain that the more we get people on treatment, the more we suppress viral load itself. And UNAIDS have confirmed that we are picking up in our number in terms of reducing the viral load itself.
How serious are those 2 problems that you've just spoken about, the drug stockouts and the rate of people defaulting on taking their medicines?
So one thing that you would generally have to acknowledge, the president himself hosted a conference last year, which was the presidential health conference, and part of it was to address the health challenges because of a crisis of our health system. And one thing that you need to acknowledge is that there was what we call the presidential health compact that was built out of that, and the whole conversation about national health insurance, which is something that must be fast-tracked. The seriousness of it means that we want to take health to the people where it matters, that people should not be struggling with access, with quality of health care, and that's what is the response that we are calling for. But as civil society, we are monitoring some of the work that is being done. Many of the NGOs of the sectors have raised critical issues that needs to be paid attention. What we need is accountability that we see from our government, but it's also implementation of the mandate that was given to government in terms of delivery or service delivery. Second thing, the defaulting aspect. People living with the HIV sector has been working hand in hand with the Department of Health. There are key organizations such as Treatment Action Campaign, National Association of People Living with HIV, Positive Women's Network, Positive Action Group. These are organizations that are working with Department of Health to address defaulters. People living with HIV can only help us to really reach out to people living with HIV and to support and ensure that everyone that is gathered around can support adequately. Those in trade unions, those who are young, those who are women, and in all their diversity can be reached by the diverse programs that we see. PEPFAR, Global Fund, and domestic resources are utilized to reach out to people through implementing the objects of the National Strategic Plan.
Ms. Letsike, thank you very much for your time. She is the South African National AIDS Council's Deputy Chairperson.